Hello friends, this video is about laparoscopy pectopexy done for a young female with uterine prolapse. So pectopexy is used to treat apical pelvic organ prolapse by suspending the uterus to iliopectineal ligament on both sides. It is considered a modern alternative to sacrocolpopexy. So in dynamic sling we are using instead of mesh we will be using a tape. So this instead of attaching mesh to sacral promontory pectopexy we usually suspend to pectineal ligament. So this avoids sacral dissection, presacral vessel injury and hypogastric nerve damage. So the indications are uterine prolapse stage 2 to 4, ward prolapse and in obese patients and patients with difficult sacral access and recurrent prolapse. So here you are seeing we are fixing the tape to the pectineal ligament on both sides. And surgical steps, we have to identify anatomical landmark like iliopectineal ligament on both sides, open the peritoneum lateral to round ligament, and the tape is passed through the cervix and it is fixed to right and left pectineal ligament, and peritoneal closure is done with the help of Raichur. So what are the advantages of sacrocolpopexy and mainly difference between pectopexy and sacrocolpopexy is here sacral dissection is not needed in pectopexy, bleeding risk is lower and the constipation risk is very low, and operative difficulty is easier compared to sacrocolpopexy, and it is very easy in obese patients and compared to sacrocolpopexy. The success rate is 90 to 95% and the recurrence chance is very low, and low mesh complication. If we are using mesh there is a chance of mesh erosion and all, and in tape there will be a very minimal compared to mesh. So and here it maintains the pelvic axis you are seeing, and it doesn't interfere with the any pregnancy. So even we can do a C-section comfortably, and now you are seeing how we even fix the tape to the cervix so that it does not mobilize the tape. So this taking stitch on both sides at the insertion site on the cervix will stabilize the tape. So here in mesh, if you put mesh there needs to be a fibrosis and all in order to prevent a prolapse, but here in tape it will be a immediate of post surgery the prolapse will be reduced. Now you might be thinking again, suppose if patient has a normal vaginal delivery, there will be any problem? So even if a patient has normal vaginal delivery there will be no problem with placing of tape over the cervix. So now you are seeing we have placed, and once we check the hemostasis we close the peritoneum. So we have done quite cases over our center and even at other centers also. The data has given a very good result, and even the patient have conceived and delivered vaginally. So if you have any doubts regarding this procedure you can easily call me or message. I can guide or help you regarding this procedure. So please subscribe this video and share to your juniors or post graduation students, because this procedure usually it's not given in the books. They have given where they are using the mesh. But here with the use of tape, usually they are not mentioned in any books. So once we close the peritoneum, the procedure is completed. Thank you.
We've been waiting for so long. We've been waiting for this time to begin. We ain't getting any older. I kinda feel a little younger. Going up, going out, going all the way, going higher.